Hi, welcome back. In today's video, I'm going to discuss personalities in psychology. In the domain of personality psychology, individual behavioral patterns are often classified based on a stable dispositional traits and emotional response tendencies, particularly in high stress or emotionally charged situations. One such enduring framework divides personality into four broad categories: type A, B, C, and D. Each consists a unique cognitive schemas and coping mechanisms. Let's discuss one by one in detail. Type A personality, the high arousal performer. Type A individuals are marked by sense of urgency, intense goal orientation, and a compulsive drive towards achievement. Their behavior is characterized by elevated autonomic nervous system, often resulting in heightened psychological arousal, even non-threatening context. Hallmarks of this personality type include excessive competitiveness, impatience, hypervigilance, and low frustration. They often exhibit what is known in health psychology as a sympathetic overdrive, where the sympathetic branch of autonomic nervous system remains chronically activated. Moreover, overcommitment to tasks and strong tendency towards workaholism further intensify stress related outcomes. And empirical research has established a link between type A behavior and increased risk for coronary heart disease, with the chronic activation of hypothalamic pituitary adrenal axis, leading to elevated cortisol levels and cardiovascular strain. Cognitive behavioral intervention focusing on relaxation training and anger management have shown promising results in mitigating these risks. Type B personality is the low arousal regulator. Type B personality, the low arousal regulator. Contrasting sharply with a type A personality, type B personality individuals are generally calm, patient, and emotionally composed. They demonstrate low baseline of physiological arousal and are often resilient in the face of external stressors. With the external locus of control, type B individuals are less likely to internalize blame or ruminate excessively on failure. Their behavioral profile is associated with high emotional intelligence, relation harmony, and the ability to engage mindful awareness and intrinsic motivation. Cognitively, they are less prone to cognitive distortions and tend to adapt adaptive coping strategies. These techniques help in reframing stressful events and maintaining emotional equilibrium. In clinical context, type B individuals are often seen as resilient and psychologically flexible, making them less susceptible to stress related psychopathology. Their balanced lifestyle and effective emotion regulate contribute significantly to long term psychological well being. Type C personality, the emotion suppressing analyst. Type C personalities are defined by the emotional inhibitions, overcompliance, and pronounced need for social approval. These individuals frequently exhibit alexithymia, a psychological construct referring to difficulty in identifying and articulating emotions. They rely heavily on repressive coping, in which negative emotions such as anger, sadness, anxiety are consciously or unconsciously suppressed to avoid interpersonal conflict or social disapproval. Behaviorally, type C individuals are highly conscientious, introverted, and inclined towards learned helplessness, a cognitive state where individuals perceive themselves as unable to influence outcomes, often as a result of chronic stress exposure. This internalization of emotional distress can manifest in psychosomatic symptoms and has been tentatively linked to the conditions like immune suppression and even cancer progression. Though these correlations remain debate in psychosomatic medicine, therapeutic approach for type C individuals often involve emotional Type D personality, the distress and withdrawn profile. Type D or distressed personality is distinguished by high levels of negative affectivity, the tendency to experience chronic negative emotions such as anxiety, depression, and irritability. This dual tendency make individual vulnerable to psychological disorders such as generalized anxiety disorder, major depressive disorder, and avoidant personality traits. Cognitively, type D individuals often engage in rumination, self criticism, and maladaptive schemas and distort their views of self and others. Their predominant use of avoidant coping strategies such as withdrawal, denial, and emotional suppression hampers their ability to resolve conflict or build strong interpersonal connection. Furthermore, type D personality is increasingly recognized as independent psychosocial risk factor for adverse cardiovascular outcomes, particularly in patients with pre-existing heart conditions. Low perceived social support further compounds their emotional vulnerability and complicate recovery. Intervention strategies for this group typically includes cognitive behavior therapy, interpersonal therapy, and programs aimed at enhancing social skills and self-efficacy. Understanding these personality types is not merely academic exercise. It has a profound clinical and practical significance. After watching this video, you can decide what personality you are going through. Thank you for watching. Don't forget to subscribe, like, and share. Thank you once again.